This is an area just coming through the pandemic. We've had a lot of clinician burnout. We now have a fair amount of fatigue in this area, but not all of it is really related to just the pandemic itself. There's an awful lot of other things that are at work there. And what are you hearing? What are you seeing in the industry around that?
It's funny. I practiced for over a decade as an ICU pharmacist before I moved into IT. And I think it's funny. It's not new. Alarm fatigue, alert fatigue. Anyone who spent time in an ICU knows it's cacophony of sounds and noises and smells, not to mention the computer system and the alerts and everything. But I think the pandemic has it's almost like press the gas pedal on this for clinicians. There's so many new demands on their time, and anything that can be perceived as a barrier just seems to escalate it. What we're hearing from folks as part of the kind of the burnout piece, the alert fatigue piece is still there. It's almost like it's exacerbated, but staffing shortages are a major problem. And it's not just from burnout, but it just worsens it. One of the physicians that I know from my past experience shared that due to staffing shortages, they actually had to stop elective procedures in the OR. That's challenging, right? That's a bottom line for a health system when you're dealing with that type of shortage.
Yeah, I just got off a call where we were talking about that one line item on everybody's P&L right now, which is just absolutely killing them, which is that contract labor line, which in a lot of cases is traveling nurses, and not only nurses, clinicians just in general, filling gaps and whatnot. And I've seen where, I think it was Peace Health, they've decided, hey, we're going to take one of these hospitals and we're going to see what the new norm is, and we're not going to have traveling nurses. And I think what they're trying to determine is what services are they going to have to shut down or whatever to maintain that facility, because they can't continue to maintain that facility with the shortages that they have and with the costs that have gone up dramatically on that specific line item.
And I think one of the other things we've heard too is with this use of contract labor to fill these gaps, where does training come in? And do you assume that there's some baseline understanding of the EHR because they've worked with it before in another health system, which ties into, it all comes back around to decision support is meant to be a stopgap, a safety valve. So it becomes even more critically important if there's someone fat fingers something in a system they're unfamiliar with. It's not one EHR is one EHR, whether it's the same software platform or not.